Well, thanks everyone. Thank you for joining today, and welcome to ReThink Health Toolbox webinar. My name is Maggie Cook, and I'm an Associate Director of Strategic Partnerships at the Rippel Foundation. Whether you're new to Rippel or we're old friends, we're so grateful to have all of you here today. If you're new to this Toolbox webinar series, fear not. You don't have to have attended any prior session to fully engage with the material we'll be sharing today. And you'll notice as we go, we'll pop things in the chat. We'll give you links to prior recordings, relevant resources, and we stand at the ready to kind of point you in any helpful direction we can. Wanted to share a little bit about what this Toolbox webinar series is. To orient us, we've shared introductions on many topics: vital conditions for health and well-being, shared stewardship, even most recently a conversation on building the will to thrive together, during which we were joined by our amazing partners at the Case Made. Recordings of past webinars are available on our website. And just a heads up, today's webinar will be the last one for 2024. We'll pick back up in January of 2025, so please stay tuned for more. And today we're going to continue this series with an introduction to an incredible interactive tool we call the Thriving Together Theater. So to set the stage today, literally and figuratively, the intent of the Toolbox webinar series is really to help all of us embrace our role in transformative systems change. It's a way for us at the Rippel Foundation to share a 101 level introduction to ReThink Health's tools, practices, and frameworks proven to drive this change that people all over the country are using today. The webinar today, however, is a slight departure from those we've shared in the past, as today we'll be providing a preview into a model that's really designed to be a facilitated experience we can take partners through. So we'll do our best to give you a taste of not only what the theater can do as a simulation model, but also how the experience of it can help stewards practice a few things like playing different roles, having difficult conversations, and ultimately making tough choices following a severe shock. And though the theater is designed to simulate quickly unfolding shocks or events as a way for us to better prepare how to respond, let's face it, we're living through some incredibly hard times right now. And some of us here today, our families, our friends, are reeling from the devastation of Helene and now Milton. We could not have predicted that this webinar would be situated squarely in the middle of such shocks, and our hearts and hopes and love are with those directly impacted. For all of y'all able to join us today, our hope is that we can walk away having gained a little insight into how to navigate strategic challenges immediately following a severe shock, and how to also think about the long-term game, as the choices we make can establish conditions for healing to happen and to enhance the vital conditions each of us needs in order to thrive. So we'll set the scene, and we've built in ample time for discussion. But for now, a few practical notes on norms. Please feel free to share your questions and reflections in the chat as we go. We'll be addressing them as best as we can live, and if we've missed anything, we can pick it back up in Q&A. If you would like to access closed captions or live transcription, we've enabled those functions where you can initiate those in the bottom ribbon of your screen. We also encourage you to turn your camera on if possible. We hope you can get grounded in this shared space and experience connectedness with those around you today. Lastly, please note a link to the recording of today's presentation, including the slides and supporting materials, will be emailed to you in about a week's time or so. And now I'm thrilled to introduce our speakers. Molly Belsky is a program associate, and Catherine Wright is Deputy Director of Strategic Initiatives, both here from the Rippel Foundation and beloved colleagues of mine. And now I will turn it over to Molly to kick things off.
Thank you, Maggie. And hi, everyone. I'm so glad to be here and so glad to see all of you. So today we are going to introduce you to the Thriving Together Theater. As Maggie said, the Thriving Together Theater is just one of many tools we use at Rippel to help community leaders practice the negotiations and collaborations they might need to help their community recover from a crisis. So we'll share interconnected factors that we'll call drivers of well-being that you'll need to balance in order to improve the health and well-being of your community. And we'll also talk about how recovery from a crisis can be more than just getting back to business as usual, how it can really be true renewal, increasing life expectancy and other factors of well-being, and how different decisions about what's important along the way, like where to invest time and money and other resources, can really impact that path towards renewal. Next slide, please. So with that, just a little more about the theater itself. It was created, like I said, to help changemakers understand the strategic challenges they would inevitably face when trying to recover from a disaster and move towards an equitable and thriving future. The theater experience is built around the drama of a shock to a community in order to set up a high-stakes facilitated negotiation that has a simulated real-world feeling of experiencing something acute and painful, which many or all of us can personally relate to. Because we unfortunately know only too well that crises can not only negatively affect the health of entire communities, but that they tend to exacerbate already existing lines of inequity, with groups that are historically marginalized, often bearing the brunt of the suffering. In these high stakes moments, like after a shock, our mental models usually default to old patterns and actions that are familiar. The theater intentionally puts us in a simulation where we can experiment. We can wear different hats and we can play different roles and have this shared experience in a safe to fail environment that can lead to important mindset shifts. I also, before we go on, just as Maggie did, do want to acknowledge the ongoing devastation in the southeastern United States right now, and recognize that there are people on this call who have been directly impacted by the destruction from Hurricane Helene last week, and just last night, Hurricane Milton. I mention it again just because we are going to be talking about the impacts that crises like these can have on communities and how to think about renewal after such shocks. And it's absolutely not lost on us that these real world events are just some of the most recent examples of this kind of massive disruption. We do know that one thing is certain about the future: there are more crises on the horizon. The Thriving Together Theater helps us to rehearse the high-stakes stewardship negotiations and play out the consequences of our values and priorities together. So now we're going to open up the playbill for the Thriving Together Theater itself. Now, this experience happens in a few acts, and this is very intentional. We start with the prologue, which is an immersive experience designed to kind of ground you in a community that you know well, and it walks you through a thought exercise of what it would feel like for that community to experience a sudden upheaval or shock. The quest for renewal comes next, where a group of peers work together and make decisions about how to bring about renewal. And along the way, they get headlines from journalists and scorecards from system scientists. We'll go over that in a bit in a minute. These are all to help them see the consequences of each decision that they make together. And they'll also get feedback from the most important source of information, the audience. Any theater experience is incomplete without a good audience. And all of these decisions are being walked through and negotiated out loud in front of the group. This is meant to be some kind of a fishbowl experience, which means that we all get to observe and practice together in a safe to fail environment. We all get to learn some of what it takes to have these conversations, and we even get to weigh in at different points about what we think the decision makers should do. And then we all get to reflect together on what we observed and how it felt, and the implications for your own community or your region or your work. So the facilitated live theater element of this tool, next slide, please, is essential and provides a number of benefits, which you can see on the screen, including you can simulate community recovery and long-term sustainable resilience planning. You can consider trade-offs together, the trade-offs that are involved in different investment decisions, and especially short-term versus long-term planning. And you can really practice those discussions that are needed for effective long-term planning, which also helps you practice multi-solving, that is a skill you really need when working in groups. So that kind of interactive part of the theater is really key to what makes it work. So now we are going to give you a taste of what it's like to step into the theater. So we'll go through the prologue together. So theater comes alive and really thrives as a tool of community building when it finds the personal connection that the audience has between the story and their own lives. So our scene setting here really depends on you. I want you to close your eyes if you want, get comfortable, really find your center, and picture a community that you know well and love. Really hold it in your mind. What is this place like? What holds it together? What are the elements of this community that make you love it? Who are the people who make this community what it is? Okay, if you're comfortable, we'd love to hear in chat what community you're picturing and anything special about it you'd like to share. I'm thinking about my hometown of Groton, Massachusetts, which is very tight-knit. Now, imagine this community living through a severe shock. It could be mass violence, fires, storms, economic collapse, a pandemic, or some other catastrophe. The exact cause of the shock is not important here. What matters is that it leaves everyone worse off than they were before. The health and well-being of this community has been drastically altered. So even before the shock, we know that things weren't perfect, largely because conditions were never built for everyone to thrive. There have always been exceptions and exclusions by race, gender, class, ability, and other human differences. There will always be people in every community who thrive alongside others who are struggling and still others who are truly suffering. Imagine hearing from researchers that the shock created less thriving and even more struggling and suffering than there was before. In the past, in your community, there have been great strides towards well-being and justice, but once again, people's commitment to thrive together is being tested. So now your challenge is to find some equitable way to increase long, thriving lives and become better prepared to weather future challenges. The theater is going to go through recovery from one shock, but the premise is that we improve resilience for your community moving forward so that you are better prepared for future shocks. Your goal is not to simply recover to pre-shock levels, but to reach even greater heights of thriving within your community, that renewal that I was talking about before. As you make decisions throughout the theater, you can pivot decisively. You can change up things as you talk through. We start the experience 2 years out from the shock, and you make decisions over the course of a decade. And your choices involve just prioritizing and proportioning out community assets across the 4 drivers of well-being, which we'll go over now. So systems research has shown that there are 4 main drivers of community well-being, meaning that investing adequate resources in each one holds the potential to increase the percentage of people in any given community that are thriving. Some of you may be familiar with these, but just to go over them, they are belonging and civic muscle, vital conditions for health and well-being, fairness in system design, and urgent services adequacy. We'll run through some overviews of these drivers in a minute, but I do also want to note here that there are previous Toolbox webinars that you can find on the Rippel website on both the vital conditions and belonging and civic muscle that will walk you through each of them in more depth and go over some more concrete examples of what it means to invest in these things. And we'll also share other resources that will help you learn more. So we'll start with urgent services. This is typically the easiest to understand. It refers to how well acute temporary needs within the community are addressed. So think emergency rooms, addiction treatment, emergency housing, cleanup from environmental disasters, etc. So if we take food as an example, an urgent service might be a food bank. And urgent services contrast with the vital conditions, which are set up to address long-term collective structural needs that can elevate the health and well-being of all. These are, you can see this list on the screen, basic needs for health and safety, humane housing, thriving natural world, meaningful work and wealth, lifelong learning, reliable transportation, and belonging and civic muscle. These are all things that all people need all the time in order to truly thrive, and they are constant rather than band-aid solutions. So if we continue with the example of food, while a food bank might be an urgent service, understanding the food system and investing in access to healthy, nourishing food for all might be an example of investing in the vital condition of basic needs. You'll notice that the last condition on the list, belonging and civic muscle, is also a driver of well-being. So we'll go to that next. So belonging and civic muscle refers to how much each community feels they are valued, and each community member, feels they are valued and supported by the community, and the extent to which they can make meaningful contributions to the community and have a hand in shaping its future. It can be measured in lots of ways, but think things like adequate social support, freedom from discrimination, civic association, a vibrant arts culture, and lots of opportunities for civic engagement and engaging with your fellow community members. So to continue with our food example, you might invest in a community dinner to bring neighbors together around food. The final driver is fairness in system design, which is essential because we know that our current system was not set up for everyone to thrive. White supremacy and systemic oppression remain embedded in our systems, and it is important to redesign them to address that legacy so that we can actively work towards a system where all people thrive, regardless of race, socioeconomic class, gender, and other differences. Fairness in system design ensures equitable distribution of resources and equitable implementation of the 4 drivers so that all members of the community are uplifted. For our food system example, investing in fairness might mean paying special attention to those communities that have the least access to nourishing food. Often, these are groups that have been historically marginalized along lines of historic discrimination. Okay, so those are the 4 drivers. I'm now going to pass it to Catherine to walk us through what the experience of the theater really feels like.
Great. Thanks so much, Molly. So as you heard, Molly talk about the challenge and the choices that each kind of group of participants has. The goal is that you're allocating these resources over those 4 drivers over 10 years. So you're starting with a kind of preset pie of what you're inheriting before the shock. And then every year, so this is going to go through to year 6, you are making choices yourselves about where you want to move things, where you want to move your assets, to truly try to think about increasing thriving in your community while also decreasing struggling and suffering. In each round, there's a time pressure because we know decisions can't be made in long periods of time. So there's about 3 to 5 minutes between each round for groups to kind of discuss together the trade-offs they're making about which drivers they want to pivot and which ones they want to move, or all those things, while also audience members are participating either through chat, polls, or verbal feedback to help participants move forward in this process. Then after each allocation, so after each 2-year cycle, there's your pie that you're putting choices into or making choices of. And you get feedback in the form of first in headlines. So there's a set of journalists who are following along in the journey with you, really sharing their perspectives of what the increases and decreases are across the drivers. Of course, they may not always get the story right. They may not report the story you want, but you do get these headlines every 2 years to kind of help influence your choices. And then there's this set of social scientists who are also supporting you that give you feedback in kind of this scorecard setup, which is really meant to show you the trends in the community, the percentages and changes of thriving, struggling, suffering, as well as your choices. and then a trend line over the course of the 10-year period to see really the numbers of people who are thriving, struggling, and suffering. And every 2 years, you have a chance to pivot and make changes based on this information. So as Maggie said, this is a little bit of a different webinar. So what I'm going to do is switch over to the theater itself. So give me 1 second. Because if we're talking about the tool, we want to show you a little bit of the tool, right? That's the point of this. So at the end of the 10-year kind of scenario that Molly was talking about, you've made all these choices, you've seen all these differences in headlines and the scorecard changing. And what we do at the end is there's this kind of path field here, which really shows not only your path, all the decisions you made, which in this lovely scrolling bar lets you kind of see the choices post shock here, all the way to 2, 4, 6, 8, and then 10. It also gives you a renewal score, which is a score between -100 and 100, which is really based on your choices as well as your strategy, how well your strategy matched up to the model. And then there's some more information there. And what we wanted to do today is really talk through 2 strategies of 2 paths that we see people typically do. And these are things we talk through at the end of every theater kind of facilitated experience to kind of talk through the pros and cons of each. So first, we're going to start with this path called flock to the rescue. And it is what it sounds. It's really a meeting demand for urgent services. This is something that obviously in the devastation we're in, the crises we're with natural disasters are feeling right now, that the goal of this strategy is really alleviate suffering above all, a very humane logic when you're dealing with crises like those and many others. So the goal is really like shift as much as possible into the demand for urgent services here. It's one of the 4 drivers Molly was talking about, while making a modest move towards fairness and system design. But the kicker here is that it moves things away, right? You only have 100% of your pie. So there are choices you're making when you're pushing money and investment into urgent services. So we wanted to show what that looks like, particularly for life expectancy, which is a pretty easy thing to understand. So here's the shock. Life expectancy dips. Here's the first year of choices, and you can see it's kind of steadily moving up. And by the time we get back to year 10, it hits right at pre-shock level. So it doesn't ever get above. So life expectancy doesn't ever increase, but you do reach where you were before the shock happened, which is a very decent goal, right? It you basically reconciled and were able to recover from the shock, which is really, really important. So another strategy we talk through is this one called even Steven. So maybe when you were hearing Molly go through all 4 of the drivers, you thought, wow, all of those seem really important. I don't think any one of those is more important than the others. A lot of other people think that. So this is really a maintaining a 25% cut of each of the drivers. So moving forward, you make no changes. You're really equal, like an even Steven all the way through the 10-year decade. But that also means that there's shifts here that you're making from the legacy of investments you had in the past. So it's an increase in fairness and system design, increase in belonging civic muscle, but a decrease in vital conditions and urgent services adequacy. So when you look at life expectancy for this one, similarly, there's a shock and it moderately goes up again. But as you get past about year 8, your life expectancy does increase by the end. So there is an increase in life expectancy in this strategy, which is, tells the story of both resilience, renewal, but also improvement, even from where you were pre-shock. And in real life, we've seen both of these, obviously. We've seen many different people using different strategies, but we find that the even Steven sometimes is a better choice because of the investment in belonging civic muscle, because it creates a little more social support. It also increases assets, which can increase thriving, which can lead to a better result, hence higher life expectancy. But with that, so you've heard me talk through 2 different strategies. There's a lot of other options, but for you, if you were doing this, which strategy would you pick? Would you pick Even Steven? Would you pick Flock to the Rescue? Or would you even pick something else that we haven't even talked about? So we're going to pop up a poll. So you let us know, which one would you pick? Flock to the Rescue, alleviate suffering as much as possible, Even Steven, everything equal. Love that. Or something else, or something that, for you. And if there's a driver you think you should pay special attention to, put it in there. So I'll give everyone a couple seconds. There's no wrong answer. We're not testing anybody on this. It's really, really just what you guys think. Okay, I think we can close it. Like, it's slowed down a little bit.
Yeah, let's see.
Great. Okay, so pretty equal. With almost 40% of people thinking Flock to the Rescue, 35% Even Steven, and 26% was something else. I'm looking at the chat here. Yeah, important to address basic needs and use the Flock to the Rescue, but important to pivot the strategy over time. I love that. That there's a pivot there. Yes, which is very much a thing you can do in this tool. Is if the strategy you're thinking about is investing, is to Flock to the Rescue, but pivoting maybe at year 6 or something, you can totally do that. So I love that. To keep putting your options in the chat. And so one of the things I love about this theater is, as Molly said, is a place to rehearse a lot of this kind of high stakes stewardship negotiations. And with a little orchestration and the right group and facilitation, it has a lot of benefits for diverse audiences, as well as different ways people are working across the country. So I wanted to share a little bit about, what have we used it to support. So first, we've seen it really beautifully support kind of decisions and conversations with policymakers about trade-offs. What does it really look like to invest short-term versus long-term? What does that really mean at a local, regional, county, even statewide, federally? And how would you maybe play that out together? We've seen it used in developing and kind of influencing conversations around development of a statewide health improvement plan, and really even what would that look like to invest in vital conditions, and what are the impacts and what kind of scenarios could you play out with that. We've seen it also a way to build trusting relationships across a place. So across residents or organizations who may not know each other, but ways to have conversations about what the goals are and the choices they want to make moving forward in any one place. We've also seen it be part of really awesome cohort learning. So things where there's a lot of different people, a lot of different places and focuses, but ways to learn together on something and bring some of those conversations back to your own places. And my favorite thing is that as hopefully you felt a little bit in the drama of Molly sharing the prologue, is that it can build momentum and also excitement about what could we do together? What are the things we're thinking about? What are the choices we would make, in this small scenario, to really kind of spark momentum for the work ahead and the work you guys want to do together. So there's a lot of other things we could talk about, but we've seen a lot of people take part in this across the country. So it goes from universities to philanthropy, kind of like statewide organizational groups or initiatives, community-led or resident-led groups, as well as statewide, kind of like statewide organizational things, as well as universities and more. So lots of things to talk about. And I know there was just a little taste of the theater. If you guys, and I want to now move us into kind of a Q&A question section. So what kind of things, as you were hearing Molly and I talk about it, might be useful for you and your colleagues? Are there others in your network you think would be interested in doing this or would like to do this with, or why? And then what questions you have about the theater. We're happy to talk through other pieces of it, other parts of the playbill, or even show the end part of the theater again. So Let's stop sharing. And I'm going to ask my colleagues about questions. And please put them in the chat too if you're interested, and I can just pull them up. Kathy, that's a great question. So to what degree is it important to advance a shared perspective on the baseline situation? Do you mean the pie, like when you first get the pie chart, like what the things you're inheriting are? Is that what you're saying, Kathy? I don't know
Well,
if
that
you're
might be one, but
okay.
you've talked about this, there's been this shock, and people may have differential experience or perspective on what that is, or what caused it, or what's our reality right now, because everybody doesn't have the same reality as you've described. Some people are thriving or some are struggling or whatever. So
Right.
is there a data set? Is there something that some conversation that's constructive to have before you start the decision making around the allocation of effort? I didn't know
Yeah.
what your experience has
No.
been.
Yeah, that's such a great question. It depends. I think typically when, and Molly, please, and others, and Bobby, share your perspectives here, but when you're going into because the theater is based on an Anytown model, it's not necessarily about your place, right? So I think the reason there is a shared perspective, I think, coming in of like, we have a place we care about, and we have a choice and some choices to make about the pie chart. But I think that is a great comment for the debrief of like, okay, now what is the experience we know is happening in our place? What are the things we're thinking about? What might this impact? What kind of trade-offs are we all thinking about to help support kind of the next step after the theater? But in it, you can have people with different perspectives in it. I think it holds that pretty well. And the negotiation part of it is part of that. Like, I actually think in this community I'm envisioning we have to invest in vital conditions, or we have to pivot, or that kind of is part of it. But Molly, would you add to that?
Yeah, no, I think that's I agree with everything you said. And I think, this particular tool is really meant to serve as an intro, and kind of a way into saying, okay, here's the kinds of conversations we can have and the kinds of trade-offs we can start to consider. And that's what really, when you go through the facilitated experience, you have that experience of talking to each other live, and then in the debrief, which is a part of the theater, there's always a debrief talking through the different paths. That's often where you can get into more kind of local, specific questions and applications, which are really important. This is, nothing if not a jumping off point to have those more specific conversations.
Right. Great. Thanks, Kathy. Just looking at Terry's question, who are the typical stewards who make these decisions in urban areas? The assumption is the local health department or other centralized health planning agency. Yeah, so there isn't necessarily assumption about who makes it. It really is for the experience and the fishbowl. It's volunteers that kind of jump into this experience to try it on and negotiate with each other. So there is no like, we need everyone who's a leader or decision maker here to be in the fishbowl, right? It really is meant for like all of us to kind of try on that. And I think again, the comment about the centralized like health planning or that infrastructure is something to think about, like the implications, as Molly's saying, like what now do we think about and what impact can we have in this room or this group or community group, or to think about like next steps on this, which might be that we have a different way to tackle this and think about investing across these drivers. But I don't know if you would add anything there, Molly, from Terry's question.
No, I mean, Bobby had a great response to Terry in chat, just about currently different people respond to different types of crises. And I just, it might be helpful. There's an example in the example slide you shared of the places where we've done this, Catherine. One of them was Archie, which is a collaborative in the Atlanta area where I presented this theater live to a group of stewards from different towns all around Atlanta. There was a fire chief, there were people from Parks and Rec in different towns, there was a mayor, and the fire chief I remember pretty distinctly because he said, I think of myself as the urgent services guy, but this is helping me see kind of why I have a vested interest in, investing in vital conditions and belonging to civic muscle. It helps me start to see the connections I have to the other stewards in this community and the communities around me, which that was cool. It's certainly not like, gonna completely shift a perspective in 3 hours, but it was a cool thing to see. Bobby, I don't know if you have anything to add to that.
Yeah, well, actually, there's an interesting connection between both of these questions that, like who shows up to help plan the path forward, and Kathy's question about what do they know about the community? Do they even have a shared understanding? In the context of this theater, like people get a playbill and you're given a circumstance, but it's very clear. I've seen this reliably over and over time of different performances when people come out and say, you know what, we ought to be thinking more in advance about what, who is thriving, who's struggling and suffering, who feels they belong. We don't know enough about our current community, and therefore we're leaving all of ourselves much more vulnerable than we need to be. And the same point here, Terry, it's like if the cast of characters changes based on the nature of the thing, then where is the center of gravity that says where are the values and the people who are living through one crisis and the next after the next? And so people start thinking ahead about, okay, that was a theater, sort of a sort of stylized experience, but they walk out ready to ask different questions and start planning differently in the real world.
Yeah. Thank you so much, Bob. Yes. And that gets to the momentum excitement point I was making, is that there is different kind of conversations and different kind of mindsets you're thinking about and different questions you're asking, which is great, especially in our line of work where we want to move beyond the status quo. And Bobby, thank you for answering the life expectancy changes. Yes, and Maggie just put in a really beautiful resource from IP3, which shares a lot of, if you're interested in more like these investments in belonging civic muscle or vital conditions, all those drivers, there's a lot of information there. Any other questions about the experience? And I will just name that in its form right now, it is both like a really nice virtual experience and in person, as like a way to, as I said, bring excitement, share like kind of those trade-offs, think about different parts of your community, but also build relationships across people, which is always really fun to facilitate as a facilitator. Any other questions? Or anything else you would want to see? Yeah, Terry.
I've never been. I've heard great things.
We're a great lab, and I welcome you all, and we certainly need the help. New Mexico is the only state who has never not been a majority minority state, and our health and equities are, and the data about them are robust. And we're building infrastructure in our urban core, which is the city of Albuquerque. But we've had 2 competing urban governments, and neither with a local health department ever. So we're germinating one now with a behavioral health focus using opioid dollars. So wish us luck and send us any info wisdom you can. Thank you.
Yes, always.
Bobby, I wonder if I could invite you in light of that, knowing that many of our partners are always in a process of doing some planning work, and many are using up final reserves of crisis response dollars, or maybe you've convinced, you're a little farther along, you've already been successful in convincing the use of normal state dollars for longer term planning, and you're in a scenario process. As the team has laid out, this is a great introductory event and kind of experience. You can bring more people into kind of where you all are already, but we do have other modeling tools that can get much more specific if you are a community, one that has readiness, that has data, and has at least the beginnings of specific plans and ideas. So I wonder if, Bobby, could you say a little bit more about that particular tool and how we use that?
Yeah, I mean, what Molly and Catherine have described so well is the structure of this around those 4 drivers, and each one of them, playing a really important role in a response when some people are struggling and suffering, and there's this immense potential for more to thrive. It becomes hard to know, like, what set of actions is really the one that we most want to commit to. And I'm being careful not to say right or wrong, better or worse, because these are value judgments, and there's a kind of a path dependency. If you make the choice to flock to the rescue, you may be sacrificing, precious years of building belonging, civic muscle, and fairness, and so you're perpetuating a certain kind of inequity in the service delivery system in order to flock to the rescue with the infrastructure you've got now. So those lessons about these drivers and the trade-offs among them and the virtues of each of them, the theater's really good at that. But it's really quick, and it's not really forcing you in the context of the theater to spell out exactly how are you going to be delivering these services and to whom, or if you want to build belonging and civic muscle, who are you building it with and how. There's a difference between doing it with youth versus doing it, in agenda planning and participatory budgeting, or, there's just like a whole array of options. And so for folks that want to convert their specific portfolio of intervention actions, like what are you using, ARPA dollars for, or, infrastructure resources, often there's a complicated portfolio of activities that are going on in the community, and it's really like mysterious. How are these supposed to combine together and result in more people thriving, fewer suffering? What does this mean? Like netting together. We don't really historically haven't had the tool to connect those detailed portfolio actions to the high level trend on well-being. And that's what sort of our latest tool is, like it's just like a more specific version of the theater that lets you play out your portfolio. And this isn't the time or place to go into the details of how that happens, but we felt the need to create it for exactly the reason that you're saying, is like, okay, I get the idea that these things are important, but how are we going to do it here with what resources? And sharpening your pencil on that requires a little bit of a different tool, and that's what we also have. We call it the Thriving Together investment model. So there's the theater, which is the play space, and then there's the investment model, which is a lot more precise. And divides by race and ethnicity, which is important because different race and ethnic groups are starting from different positions. So, back to Kathy's question, like, what do we know about this community? Often we don't even take the time to consider who's differently situated right at the beginning. And so in the flock to the rescue motive, you can perpetuate a lot of inequity without even thinking about it. If you aren't thinking in advance about how are we going to react differently to people who are, very far apart in their starting conditions.
And the trade-offs, I will say, in the screen that Catherine showed, some of the scenarios where you don't flock to the rescue, it takes a lot longer with that little line graph to go up. And it spends a lot more time in the struggling and suffering kind of life expectancy has dipped. And that is a trade-off that people notice, and they say, like, how do you justify, spending more time trying to recover and more time, getting people this urgent help? And it is like Bobby said, it is a value judgment. And that's one of the things we mean when we say trade-offs, is just, you can get back to greater than you were before, to be more well and better and a higher life expectancy. And yet it may take more time.
Right. Which are all things, as Bobby said, like the intro of it is just to try it on. And remember, this is, and one thing we see very importantly is in that scenario planning, you can try some things on, and then you even think about what that means for some of these more detailed scenario planning and models to support your work. Terry, your question about how make this cross siloed models like housing first would show some more recent evidence prolonging. Yeah, I don't know. Bobby, do you have a thought on that?
I mean, yeah, I mean, that's a specific version of the general dynamics that we're talking about here, right? When you know, somebody presents with an addiction, you know, there's a whole script that kicks in that says, let's treat that addiction. And then suddenly somebody sooner or later discovers there's an underlying housing issue. And so somebody then says, you know what, housing comes first. And they're not wrong. It's just that we aren't rehearsed at playing out the consequences of the whiplash that comes from everybody having their like kind of narrow tunnel vision on what they're doing to help make things better. And one thing I can say for sure is that if you have a lot of people doing their part in, you know, across all the things that touch well-being, and they're assuming other people are going to do their part, it doesn't necessarily result in a very well-designed system, right? It results in a lot of fragmentation. It spreads resources really thin. It kind of mostly becomes so thin that you're not really changing the status quo, and you're not making a real move to say, okay, this crisis is our time to change what we really value, and get away from that precipice of the, you know, of the same people being vulnerable, depending on, you know, which shock it's going to be next. So I think your example is like, it's a symptom of the way we do it now. And we need to have a whole other kind of conversation to get past it, because I don't want to have a tug of war between housing and addiction either. That's kind of like a losing argument, and communities can do so much better as long as the sophistication of the stewardship negotiation is built better. And that's kind of the reason for the theater, was people need a place to practice that, because they're not learning it on the job. They're not learning it in school. You get the picture.
Yeah. Great. Thanks so much, Bobby. And so the question about being ready for the theater, we're happy to talk more about if you'd be interested in hosting one of these theaters, and with the tool facilitated either in person or virtual. And Maggie put her email, but Maggie's going to go through this a little bit more, but thank you for jumping in. We're just, I don't know, so excited to share this with folks. It's one of my favorite tools to facilitate, but so thank you, Maggie. I'm going to kick it over to you. Give some more resources.
Thank you. Yeah, Catherine, if you just want to kind of toggle through these. Okay, so today we got a taste of, a little introduction to the Thriving Together Theater. You can see how it's a simulation model that requires conversation, role playing, thinking about some really tough decisions, how we make them today, how we might make them differently, considering what we know now in the future. So thanks to Molly and Catherine for leading us through a few of those examples. And as with all of these webinars, we hope that this information and these insights shared help you and your work. To augment what was shared during this very brief hour on this slide are additional resources that you can access to learn more and deepen your own practice. Again, we'll be sending out these materials afterwards as well. So next slide. Oh, well, I guess I could just say really quickly, we've got a dedicated portion of our website on the Thriving Together Theater. There you will find many of the resources that are listed here. We've got a video of this in action with our colleagues at Healthy Communities Delaware. You can gain access to the playbill itself, and kind of it's a cool way. It makes you feel like you are in a theater, and you can sort of see the table of contents and the run of show. We've included the link of the Thriving Together Springboard, which was mentioned earlier. In conjunction with the Thriving Together Springboard, we've developed this tool. And of course, a publication on a little bit more of how the tool was developed and the science behind it. Next slides, please. So as I mentioned at the top of the call, really the intent of this series is to provide a 101 introduction to our content, our tools and frameworks. Interested in learning more, going deeper into that content, or partnering with us, please feel free to reach out to me anytime. We hope that you'll take a few minutes to fill out a very brief survey on today's webinar. Your feedback is always very valuable, and it helps us improve our future offerings. As we usually say when we close these things out, it takes a lot to diffuse these efforts and to navigate different futures and ways of showing up in community with one another, especially with shared stewardship in mind. Rippel's committed to sharing stories of stewardship in action for others to see and learn from and be inspired by. So we invite you to share those stories with us, and we love to help amplify them in any way we can. Please feel free to reach out directly to Layla Hussein, our Interim Director of Communications, to share your story. As I mentioned earlier, our next webinar will take place in early 2025, so keep a lookout in your email and open up our newsletters, and you'll see more about that. And lastly, just one reminder once again that the resources from today's webinar, including the slides and a recording of today's session, will be emailed to all of you, and will also be updated on the website. So with that, we thank you all very much for joining. We can stay on the line for a couple more minutes if there are any remaining questions. But I did just want to take one last opportunity to say thank you so much for being here today and hanging in there. We know a lot of these conversations are difficult and necessary to have. At the same time, real severe shocks are happening in our everyday lives. So hopefully you find these tools useful, the conversation engaging, and we're so grateful to have all these